Oh, wait a second.
This video is going to be phenomenal.
I have zero leverage to put this.
Incredibly scientific.
There we go. Okay. Sorry. I think I got it.
Now hook it through the arm. Yep. And why don't you go step up Chapman where you're going to kind of be in the treadmill, which will be right there, perfect. So we want to make sure there's enough slack for him, but we want to make sure it's not yanking on the tube where the filter is at.
It's a double back system. You gotta put it through the loop up there and fold it backwards like it is in the mask.
Oh, I see.
Whew, that was a good one.
What was this one?
You get it?
Yeah.
All right. So
Is that
now
enough slack?
we're going to come around. Back if you can walk around. Oh, did you hit it? Pause.
No, it's gone.
So we're just going to come around to the front. And so what's going to happen is we're going to hit OK.
Ready?
And so the treadmill won't quite start yet. We're going to take this and we're going to pull it over to the side. So this is the treadmill controls, so we always can see them, and pull it over a little bit further so it's right at the edge. This is going to go ahead and, well, it already did. So actually it's going to just start detecting his breathing, and it looks like it already went through calibration, so hit OK. It's going to start in any second now. The treadmill will start, Chapman, so be ready. The treadmill started. Once we see these boxes pop up, the treadmill will start at that time. So right now he's on a warm-up phase, and he's going to go through 60 seconds of a warm-up phase, and there's going to be a 10-second transition until we hit stage 1. And we'll demo this right now. So go ahead and hit advance, and we're going to go ahead and enter in the free text. We're going to enter warm-up and hit save on this, or OK, and that'll just post the warm-up right here on our grid. This is what we're going to print out at the very end. So when again, the little tube problem. So this is going to be our printout at the very end that we're going to be using, and this is every 15 seconds. This will update all this information and put it out in a graph form, or not a graph form, but in a spreadsheet form. So our warm-up is.
Oh, no. Sorry.
We're about ready to hit stage 1. So go ahead and hit events, and then go ahead and hit stage 1. And this just switched over to something called stage 2, but actually we're in stage 1 of the Bruce protocol right now. The treadmill just came up to 10 degrees, and it's at a 1.7 miles per hour right now. So even though this says stage 2, we're in stage 1. It included the warm-up as the first stage, so that's gonna maybe throw you off a little bit. These are all the stages that we'll be going through. So stage 1 all the way through stage 7. I've never seen anyone go past stage 5 before. Right now he's at stage 1, which he's at a speed of 1.7 and a grade of 10%. So this is how you can follow it along. The computer will automatically shift the treadmill, and it'll automatically move it to the next stage. So the person working the computer is going to monitor this number here. When this gets to 2 minutes and 30 seconds, you're going to go ahead and hit events. And what we'll do then, and we'll show you just a second when it happens, the person that's monitoring the client is going to go ask them what their perceived rate of exertion is, and or the rate of perceived exertion, and then we're going to record that. So that'll happen. We'll start doing all that when this number hits 2 minutes and 30 seconds. So right now we can start looking at all the numbers in the boxes here. So we've got RER, which is kind of a number we're going to keep close track of. So this represents fats versus carbohydrates that are being burned. When we're at about 0.75 to 0.8, roughly in that area, we're at 50% burning carbohydrates, 50% burning fat. When this number jumps up to 1.0, we're burning primarily carbohydrates. So when we start burning only carbohydrates, our body has a limited supply of that carbohydrates in the muscles and the liver. So once it exhausts that, then the person will no longer be able to continue running. They'll be so fatigued that they'll want to stop. So that's an important number to watch. The respiratory rate is right here. Respiratory rate, once it hits in the 30s and 40s, we know that they're really exerting themselves a lot. So we can track that number. So between this number and that number, it's going to give us a lot of information. And of course the heart rate. So Chapman is 21 years old. So his maximum heart rate is 21 minus 220. So that puts him at 199. So when he starts getting up into the 190s here, we know that he is exerting maximal amount. So right now we're ready to go and go to the event section. So we hit events tab, and then we put in here stage 2, or actually put end of stage 1, my bad, end of stage 1. And then up here we need to put perceived rate of exertion. So Katie, why don't you go get that number?
Chapman, how you feeling?
And we have to do it in the next.
7?
Okay.
Feels great.
Okay, so go ahead and hit enter. Yep. So we put it in just a little bit late. So next time we'll just get it in a little bit earlier. But but that's what we're going to do for each stage. So we're.
Do you want me to do stage 2 then?
No, we can just put end of stage 2 when we hit the 2 minutes and 30 seconds. So again, we're going to track these numbers. So we have the RER, which is right up here. We have respiration rate, heart rate. This is the amount of liters per minute that he's breathing. Basically, it's the air exchange he has going through his lungs. This is actually the VO2 max. This is the number we're seeing. We want to try to get him up at his highest level of endurance performance to see what this number is going to be, and then we can rate him as an endurance athlete, or we can rate his maximal oxygen that he can consume to maintain activity. So I think that covers a lot of what the important stuff that's up here right now. Bracken, is there anything you want to add to that?
No, I think that you covered it pretty in depth.
Okay, so that's what we're going to do. So now we're just going to continue as he goes through the whole test, entering events at the 2 minute and 30 seconds, and we're just going to work it up from there. So the whole time I just want to mention that we want to make sure we're talking to our patient, making sure they're okay, and just making sure they're comfortable. Another thing that we probably should have mentioned too is that when they're done, when they feel like they're being exhausted and they want to stop the test, they'll put their hands down on the rails, and they'll put their feet on the sides. That's how they end the test. So and we just want to make sure we communicate to them. We should have probably put it earlier in the video, but at some point we really needed to communicate that to them. So we also want to give them encouragement as they get further and further into the test. We want to just make sure we give them positive reinforcement so they keep working hard at it. When they're in the stage 3, it's kind of an in-between between walking and running, and you just tell them, hey, this is going to feel awkward, so just do the best you can. If you want to run, you can, or jog. If you want to walk fast, you can, just whatever comfortable. It doesn't really matter. And they might even say this feels awkward. Just say, yep, it does. Just do what you need to do. So I think that's it for right now, and we're gonna cut for now, and then we'll show at the ending of the test. Okay, so we just entered stage 4. He's still doing really well. Heart rate's not too bad. His respiration's getting up there a little bit, and his RER is there. He's kind of in the in-between walk-run stage. It's an awkward stage for him. But because his respiration's so high up here, I think we're kind of maybe nearing the end. His RER is definitely there. His VO2 is at a 46, high 40s, which I would expect a little bit higher from Chapman, but he's been doing a lot of really good academic work and probably hasn't been doing any working out. So that's good though. I mean, he's doing good, but he's doing well. So hang in there, Chapman. We got a little bit more to go. Heart rate's getting up there again, and again, respirations are still up there. So
VO2 just jumped up again.
We're getting close to the end here, but keep going, Chapman. Push it now. Push it.
It is a weird pace.
Why don't you stabilize that tube just
Got
to
it.
make sure he's.
Yeah, what? Right here?
Or just kind of hold it down here just to.
Make sure it doesn't pop out of the bottom.
Yeah, I just want to make sure it's kind of stable. We'll have to get a different arm on that. So, again, everything's
Doing
pretty
great.
stable right now. We've got a 40, well, actually a 55, which is probably more where he's at right now. And his heart rate just shifted down to 121. So he's got another half an hour to go on this thing before. No, I don't think so. So the machine is just every 15 seconds will update, and now his heart rate is 73. So he's definitely.
He's getting used to the running. Now his heart rate just dropped.
Yeah. So we're still doing good here right now. He's doing good. Keep going, Chapman. Good job.
Great.
We just entered stage 5. This is a real demanding stage. So his respiration rate's up in the 40s, so that's pretty good. His VO2 is 56, kind of what I was expecting. Something's going wrong with the heart rate monitor right now, so we're not going to pay too much attention to that. We're just going to keep our eye on the RAR, which is really high, and respiration's really high, and his VO2 is getting close to 60. So keep going, Chapman. You're doing good. So his perceived rate of exertion was at 16, so he's probably getting close to the end here. So we'll just kind of cheer him on a little bit and just keep going, Chapman. You're doing a fabulous job. So I guarantee his heart rate is not 125 right now or 131. So we have a little, okay, he just stopped it. So now we're gonna go ahead and hit cool down. So cool down will lower the speed down, and it'll also lower the machine down. So when he's ready, he can start walking on that. And it's important for him to have him do a cool down phase, just for his muscles and everything. And we can still observe what's happening with respiration and VO2. All these numbers, we can watch them come down. So when you're testing your person, just have them do at least a 2-minute, I think we said like a 4-minute cool down, just so you can start to watch these numbers and make sure everything comes back. Yep, so just hit events, that's a good point. And make sure you hit cool down here, yep. So as soon as you start the cool down, just hit the cool down. Perfect. And we're just gonna watch these numbers drop, and that's gonna be the end of the test for this section of it. So okay, so we're into the cool down phase, almost 2 minutes. And again, I want you to do 4 minutes when you're doing your clients. We can just see the respiration rates drop down, the VO2s drop down. This number is going to stay high for a while because he's still in carbohydrate burning mode, and his ventilation is still pretty high, but everything else is coming down. Everything's actually being pretty normal. Heart rate actually started to kick in and started to work, so his heart rate is probably close to that right now. So next part of the test, we just hit end test, and we just go to yes, we want to end the test, and we want to talk about if we want to add any notes for here, that's fine.
And Chapman did a good job.
Yeah. And that's a great thing to put in here. Heart rate monitor was not working. And so then, yep, any notes, anything you want to put in there, Chapman did a great job. Good. And then we just hit OK. And we want to hit OK for this because we want to record it. And then at this point, we can ask for a report to be printed or any graph reports. We're not going to do that. We're just going to hit close. We're going to download everything to a flash drive, so everyone will need to have access to a flash drive, where we could share a flash drive where we could download it so we can print everything. So that is the end of the test. There is kind of a quirky way to stop the treadmill, so go to VO2 metabolic testing, go to OK, and go to OK, and hit OK, and that'll stop the treadmill. Yep,
And then you just cancel everything.
I really gotta warn you when I do stop.
and then just hit
Yes.
cancel. Just hit cancel right here, and then hit cancel, and hit cancel, and we just cancel out everything. Then we go over and we take Chapman. We take the headpiece off right away, and then we offer him a towel to dry off with, and then the person who's tending to Chapman, then you just take the assembly off, and then we're going to go clean the assembly, wash everything out, and then put it out to dry on a towel to dry, and probably cut.